Okay, I am Salome Maswime. I grew up in Limpopo. I'm from a place called Botlokwa. I did my primary school in Venda and my high school in Polokwane. And so really grew up as a young child coming from a family that was mostly academic, with my father working as a professor of theology and my mother as a teacher. And when I finished high school, I decided to study medicine. I got accepted at the University of KwaZulu-Natal, where I did my undergrad. After that, did my internship com service, and then went to specialize at the University of the Witwatersrand. And after specializing, I then decided to do a PhD, and then did a postdoc, went overseas with Harvard Medical School and Massachusetts General Hospital, and ended up in Cape Town now as an associate professor and head of global surgery. Okay, so my job is very interesting because every day is completely different. So when I worked as an obstetrician, I worked in a labor ward. I worked, most of the years, I worked at Chris Hani Baragwanath Academic Hospital in Johannesburg, Soweto, and that was more predictable. I'd know that I'm either in the labor ward, in the high care, antenatal, postnatal wards. But in my new job as the head of global surgery, I work with all the surgical disciplines, anesthesia, obstetrics and gynae. And so my job ranges from working with clinicians in any surgical discipline to engaging with policymakers in different countries, to working with the international global surgery community. And so I spend a lot of time on Zoom calls engaging with international experts and people doing global surgery across the world. But we try more to focus on South Africa, what's happening locally, and working with our African counterparts as well. So when I went into medicine, I really went into it because I felt I could make a difference. I really thought that I'd be able to impact, make a difference, influence, impact lives and healthcare. And so I went into it, I think, from a place of compassion and really wanting to make a difference. So getting into medicine, I found it wasn't what I expected it would be. So because I went in there feeling that this was a place to make a huge difference and influence, the world and change, but it felt a bit lonely in that I felt I could only influence the patients that were in front of me. And so for someone who was thinking that, the world will become a stage for you, it felt very much it's you and your patient inside of a consultation room. And so the first few years, I actually made a bold decision that I was going to quit medicine and pursue something different. But I stuck it through, and I think when I got to the stage of my life where I could actually quit and move away, I decided I wasn't going to. So that was roundabout community service time, where I actually took time off and didn't work for a few months. And so when I went back to the clinical platform, I got put into a labor ward by my clinical manager one day and went in kind of kicking and screaming. At first I didn't enjoy it, and then I started enjoying, the whole being in the labor ward, babies, delivering babies, seeing moms, and really excited to see their babies for the first time. And so I think that caught a part of me that I really felt it was really rewarding. But then I also started to deal with death when babies die, when mothers die. How do we feel as healthcare workers? Did we do enough? Is there something different that could have been done? And I often felt like I got the raw deal as a junior doctor because my health system wasn't always equipped for me to look after the patients in the way that I wanted to look after them. I didn't always have the resources, and I also didn't know what to do in some cases. And so that's how I decided to specialize, thinking that I'll get more knowledge and know how to manage patients better. But then after specializing, started doing research on maternal deaths and found that the problems were even bigger than I thought. And that's when I started to learn about health systems, and that, you need to influence a health system to improve outcomes. So it's not just the number of doctors that are there, it's what resources do they have. And so that's how I moved into this world of global health and global surgery, because I could see that there were differences between healthcare, say, in rural areas and healthcare in the cities, and across differences between countries as well. And I thought if I could influence the health system, then it would make healthcare better for others who were like me before, wanting to make a difference but without the resources to do it.
This video is sponsored by Valencia Institute. Valencia Institute is an education company that partners with leading education institutions to offer aspirational high school experiences to learners around the world. If you haven't heard, Valencia Institute has partnered with the University of Cape Town to offer the exciting new UCT Online High School. The UCT Online High School is the most affordable private school in South Africa and offers an innovative CAPS curriculum from grade 8 to 11, with grade 12 being offered in 2023. The UCT Online High School ecosystem is designed to help learners unleash their potential and set them up for success in school, university and life. If you'd like to find out more about the UCT Online High School, I previously made an overview video as well as an in-depth interview with their CEO Robert Paddock. There are links in the description to both of these videos, so check them out. Partnerships like these make it possible for me to continue producing these videos, and I would appreciate it if you would support the companies and individuals who support Silverstream Learning. So click on the links in the description below to find out more about the UCT Online High School. Like and share this video with friends and family, and subscribe to the channel, as it really goes a long way. But now let's get back to the video.
So I'll speak about the challenges as a woman, and I think it was a bit more for me, because as a young woman of color, and so always being the odd one out in a room, where you walk into a room and no one looks like you, no one speaks like you, and even when you want to put your opinions forward, not everyone is going to support and back them up, because they're coming from the outsider in the room. So I've been to many countries representing, of course, the work that I do, and still I find myself in many places where I'm the youngest, I'm the only black person in the room, and I'm the only woman. But you have to stick it through and believe what you believe in. And fight for the things that you believe in, because no one else is going to do it. As a maternal health expert, I think my biggest thing was the people that suffer the most are women and women of color. And if no one is there to represent them, then what we are seeing will continue to happen. So I've seen it as an advantage that because I'm a woman, I can speak better for women's health issues, because they affect me directly as a woman. So the advice that I would give to myself back when I was in high school, I think the one is just not giving up on your dream. Many of us, when we are young at that age, know what we want to become in life, and you go to university, you start working, and what you face often makes you to give up on what you believe in, on what you want to see. But it's those of you who stick it through to say, one day I want to be successful, one day I want to make a difference, I want to own whatever, a big house, whatever your dreams are. So to never give up on your dreams, no matter how difficult life becomes after you finish high school. Number two, don't listen to those who discourage you. I was told by my high school guidance teacher that I would never be accepted into a medical school. Had I listened, I would have applied for something different. I wouldn't have followed the path that I was destined to follow. And so sometimes people don't see the same picture of you that you see when you look in the mirror. And so don't listen to those who say you can't do it. And the third thing that I would advise is finding yourself a good support system. Stick with those who encourage you, support you, and believe in you. And this becomes important in life when things get difficult and challenging. If you've got positive people influencing you, you've got good friends that are just as ambitious as you are, you will find it much easier to follow your purpose and dreams. But if you've got negative, advice going on, your peers can really derail you and take you on the wrong path. So choose your friends very carefully and wisely, and create a support system through them so that you can all advance your careers and lives in the future together. So in closing, I think one of the biggest influences that I had in my life was my father, who always and still believes in me right now. And so I think more than the dreams that we have, more than the friends, but having people that will really take their time to guide you, mentor you, support you, can make a huge difference. And I think looking for mentors that believe in you and can support you is really important in life, because even at times where I failed exams and things didn't go how I wanted them to go, there was always somebody who said to me, don't give up, keep going. And so my advice is dream big. The world is your oyster when you finish matric. There's a lot of work that you need to do, get an education and plan your future. But also make sure that you're not trying to do this all on your own. Find people that will support you and give you opportunities to succeed and excel in life.